On April 3rd, a group of doctors came to Montpelier to speak out against Green Mountain Care, Vermont's single-payer health care law. Most specifically, they're upset by a provision in the law that would allow the Green Mountain Care Board to effectively abolish the right of a patient to obtain care from an independent health care provider with private funding outside the governance of the single-payer system. Dr. Robert Emmons led the press conference.
2 weeks ago, the Vermont House announced its intention to regulate the private practice of medicine in Vermont out of existence. A bill designed to protect the right of patients to enter into private contracts with their doctors was voted down as a threat to the viability of Green Mountain Care. The scientific evidence available does not demonstrate that the move from big insurance to big government will help physicians to take better care of their patients. When the state controls how doctors are paid, it opens the door for the state to use an elaborate system of financial rewards and punishments to manipulate the clinical decision-making of doctors. When the state's central database is up and running with no opting out, the bond of trust between patient and doctor will be strained to the limit.
From an ethical point of view, I always want to do what's best for each and every one of my patients. If you're my patient, I want to do what's best for you. And if some bureaucrat somewhere says, oh, you can't do that, that goes against ethics. I mean, healthcare is all about patients. It's not about the system. Sure, the system has roles, but we're focusing on the system's needs, instead of each and individual patient's needs. I'll give you an example of what happened in UK. In 2008, a big scandal broke out when patients suddenly realized, it got leaked, that primary care physicians were getting bonuses from the National Health Service to deny patients' rights to be seen by a specialist, to save money for the system. Is that right? As a physician, I would never, ever want to be in that position where I'm saying I'm being bribed with money to save money for the system and to the detriment of my patient. That's what we're talking about.
The way the Green Mountain Care system is currently planned, it hasn't happened yet, but the way it's planned, it is not compatible with the current code of medical ethics. There is not one mention of medical ethics in Act 48. There's not one mention of medical ethics in any of the publications from the Green Mountain Care Board. And when I make inquiries to the Green Mountain Care Board about medical ethics, they won't respond to me.
What it really is saying, it's a monopoly. One payer, one monopoly. You have no choice. You can't do this or that. It will be decided for you. Tell us what you want. Yeah, we can't do your thing. We're going to do it our way.
So the other thing is, and this is off the beat a little bit here, we were promised a while ago that there would be tort reform, and I dare not say that here, but it hasn't happened.
It's not necessarily that the Green Mountain Care Board will tell doctors directly how long their visits will be, and that's not necessarily going to come from the medical director of a group. But when you create regulations and when you set reimbursement rates, those have the effect of putting doctors and other medical professionals into those kinds of boxes. It can be done directly or indirectly.
The doctors also addressed some of the criticisms leveled against opponents of Green Mountain Care.
What you're criticizing is business as usual in dozens of other countries, and they're not dying like flies. And what I'd like to say to this physician who wrote in this comment, and in all those other countries that you cite, no other country has gone as far as Vermont plans to go in regulating private practice out of existence.
This is a debate we've had before, is that, well, the insurance companies are doing this and they're denying services, so what's your big gripe about the government doing the same? I can tell you the differences, and I've experienced it firsthand. I've had problems with insurance companies. I've contacted Montpelier, it used to be called Michigan, now it's the Department of Federal Regulation or Financial Regulation. I complained. The government went to bat for me and my patients and fought against the insurance companies. They actually ended up with a big lawsuit because they were denying service. When you're dealing with just one government system, who do you go to help you? I mean, you have no recourse. In fact, Green Mountain Care Board regulates itself.
Representative Cynthia Browning, a Democrat from Arlington, offered legislation that would have solved the doctors' concerns and guaranteed the rights of patients and doctors to seek and provide care outside the Green Mountain Care monopoly. But this was defeated in the House by a vote of 44 to 94. Still, Representative Browning has hopes that the issue will not go away.
I'm concerned that the board may set rates at levels that will be too low for certain specialties. We are not talking about doctors that will only see wealthy patients or that will create a sort of another medical system aside from public insurance. We're guaranteeing Vermont patients and Vermont doctors the ability to practice and to provide care and to seek care as they choose. So that was my motivation for offering the amendment. I was very sorry that it failed, but I don't think that the concern has gone away, and I'm hoping we can pursue this in this idea in other contexts.